Does the IUI catheter hurt during fertility treatment? Many women wonder if the insertion of the catheter during intrauterine insemination is painful. The good news is that most women find the procedure to be only mildly uncomfortable rather than painful. During IUI, a healthcare provider gently inserts a very thin, flexible tube called a catheter through the cervix into the uterus to deposit sperm. Because the catheter is small and flexible, it usually causes only a brief sensation of pressure or a slight pinching as it passes through the cervix. Some women describe feeling a mild cramp or a sensation similar to menstrual cramps during or shortly after the procedure. The level of discomfort can vary from person to person. Factors like individual pain tolerance, anxiety, or the skill of the medical professional performing the IUI can influence how comfortable or uncomfortable the experience feels. Women with a higher sensitivity or with conditions like endometriosis, which can cause pelvic pain, might experience slightly more discomfort. However, even in these cases, the procedure remains minimally invasive and is generally well tolerated. It is common to experience some cramping or light spotting after the procedure. This can happen because the cervix is slightly irritated or scratched during insertion, but it is usually mild and temporary. The discomfort often resembles menstrual cramps and tends to resolve quickly. Severe pain, heavy bleeding, or fever are not typical and should prompt immediate consultation with a healthcare provider to rule out any complications. In the context of fertility treatments like ovulation induction, combined with intrauterine insemination, some women may experience additional sensations related to ovarian stimulation, such as bloating or mild pelvic discomfort, but these are separate from the catheter insertion itself. For women with endometriosis, who may have increased pelvic sensitivity, the experience might be slightly different, but the procedure still generally causes only minor discomfort. Overall, the insertion of the IUI catheter is a quick, minimally invasive step in fertility treatment. It does not usually require anesthesia and is considered tolerable for most women. Any discomfort experienced is typically brief and manageable. Healthcare providers are trained to make the process as smooth as possible and can offer guidance to help reduce any discomfort or anxiety. If you have concerns about pain or discomfort, discussing them with your doctor beforehand can help ensure you feel supported and prepared for the procedure. Remember, always consult your healthcare provider for personalized advice and to address any specific health considerations.